This is Dentistry Disrupted with Dr. Craig D. Clayton. I'm a wellness and biomimetic dentist, passionate changemaker, social media thought leader, and educator on disrupting the way we approach oral healthcare. Come along with me as we journey towards a healthier and more empowered you. Hello and welcome to today's episode. I am very, very excited to have a special guest on the show with me today, Samantha Nicollelo. She is a periodontal therapist here in restoration dentistry, also known as a hygienist, but I think periodontal therapist is much more accurate. So that is the title that she has in our office, but she is also a myofunctional therapist, which we'll kind of flesh out later in the episode. But we thought it'd be fun to start with how we met because she joined the team last July, but it's kind of a fun story how we met. So I'll let Sammie take the floor here and tell that story.
Yeah, we met about a year ago and we went to an introductory breathing course held by Dr. Zaghi. And in where we live in Boise, Meridian, Idaho, Dr. Zaghi has never come to this area before. So it was a really big deal. We both went solo and we happened to sit next to each other, introduce each other, and it started our journey in Airway together. And it's been so exciting. You know, I joined the practice as a hygienist and talked about Airway a little bit. And I'm so grateful to Dr. Clayton and the rest of the team for allowing me to have my passion be known about the airway and breathing space.
And it's wild how the world works because I actually got invited to this Airway seminar by Sammie's former employer. So it's really kind of weird how that happened. So I met this dentist, and I met him through another dentist that's focused on airway medicine and been interested in the space, especially after reading the book Breathe by James Nestor. So I get invited to this seminar, right? And as Sammie said, we ended up sitting right next to each other, but it was one of those awkward things where like I like to sit in the front and there were like lots of sections that there were like empty seats and I typically will just sit by myself. But I think it was one of those things where I just kind of maybe made eye contact with her first. I'm like, okay, I guess I'm sitting right here.
I guess I looked really cool that
Yeah.
day.
Like she's sitting here solo. I guess I'll sit right next to her. Uh, and then we started talking and and then didn't keep in contact. But this seminar just blew my mind.
Mm-hmm.
It absolutely blew my mind. I was not expecting at all to leave with the feelings that I did.
Mm-hmm.
And then fast forward, we're looking for a new hygienist, and Sammie applies. And then
Mm-hmm.
we put that together of, oh my gosh, I think we sat next to each other
Yep.
at this course.
Yeah.
And then she really motivated me more. And so I am equally grateful to you, Sammie, for adding fuel to that fire and motivating me. And then together, yeah, we went to that airway course in October, and
Mm-hmm.
it was just it's been fun. It's been really fun. We mentioned Dr. Zaghi, and he's a very important, prominent role in whole this whole field of airway medicine. So we'll talk about him a little bit later, but we're going to start off with a very important question. Sammie, how many people are suffering from an airway related problem today? How common is it?
It's so hard to give a definitive number about how many people are suffering. But let's just take it back into my role as a hygienist. If I have 8 patients in a day, I could probably talk to 7 out of 8 of those patients about something related to airway health. And the important aspect of about being a hygienist is that I see lots of signs and symptoms when I'm doing therapeutic hygiene services. So really, hygienists and dentists are in a really great spot to be one of the first observers, or at least have that conversation with their patients regarding airway health.
Hmm, that's really cool.
Mm-hmm.
That's really cool. And that's a high percentage. It's something like 86, 87%
It's
of the patients you
outrageous.
see.
Yeah.
That's really high. And what's even higher, right, is the rate of children that we're
Hmm.
seeing. What's the statistic as far as like, isn't it 90%?
It's up there. And I think on a daily basis, if you're out, once you start noticing the signs and symptoms of airway health and then the disorders of it, it's so hard to not see it. Once you know it, you just can't unsee it. And it's just so prevalent.
Yes. Yeah.
Hmm.
Yeah. Exactly. Once you see it, once you understand what to look for. Eliza tells me all the time. She's like, "Oh my gosh,
Hmm.
I never used to notice these things." Then I was on the ski mountain the other day, and I'm looking at these three lifties. When two of the three aren't talking, then the two that are not are just sitting there with their mouths like just wide open,
Yep,
wide open.
totally.
So, but why is this a problem
I
at
th-
large?
I think it's such a problem because we've been told for so long that a lot of the signs and symptoms that we see for airway are normal because it's so common. And that we didn't really notice or realize the impact of oral overall health that airway and breathing issues have caused. We've chalked it up to genetics only, or we can just have a medication to solve issues. But really, if we go root cause, it sounds so simplistic, but a lot of times it's airway driven issues that maybe we could have identified.
What are some of these prominent issues? Like, what are these health consequences that we're seeing?
I think big ones to take note of are your increased risk factor for stroke, for heart disease and heart attacks, for having risk factors for Alzheimer's and dementia. Those are huge risk factors that have a correlation connection to airway issues.
Interesting. That is really interesting. You're telling me that breathing through my mouth increases my risk factors of having Alzheimer's or heart disease down the road?
Yes, it's that cascading effect of the inflammatory response or putting us into that sympathetic pathway where our cortisol levels are heightened and we have stress factors throughout our body, and our body will compensate for those aspects. The science isn't fully well known, but research is always being conducted right now, which is exciting and fabulous. But there is a strong connection between the two, having this chronic mouth breathing component and what it's doing to us and overall health.
That's fascinating. Yeah, it's been really eye-opening to learn about because I feel like this airway medicine field has maybe in some ways developed kind of a negative connotation or kind of it's become a woo-woo thing, perhaps because people feel like at large that all this talk about tongue ties, that it's over discussed, it's over diagnosed. Pediatricians come out and make a statement together in their you know US Academy, if you will, that this tongue tie issue is largely not an issue. It's not affecting kids' speech. It's not affecting kids' quality of life. So there's a lot of conflicting messaging about this, which is pretty unfortunate. And I was on that side in some degree of, not quite gaslighting everything, but definitely feeling like, is this overdiagnosed? And then I read the book Breathe, and I went to Dr. Zaghi's seminar that was 3 hours long, and that changed everything for me.
Mm-hmm.
It was, yeah, it was amazing. So that is a good place to start. You that is listening right now, go get that book, audiobook, listen to it while you're doing chores around the house, commuting to work. It will definitely, I think it'll blow your mind. But Sammy, what are some signs? What is something our listener could look for that could indicate that they have an airway problem? Maybe their child, their spouse, partner, family member.
When I'm talking to a patient about airway concerns, things I'm asking for are, how well are you sleeping? Do you feel rested when you wake up in the morning? Do you feel like you could take a nap throughout the day? Or if you're looking just at a child, are they tossing and turning throughout, the night? Do they have their head arched in a position which may not look very comfortable.
Like arched
Arched
up,
up.
right? Like,
Yes.
oh, it looks so. My son does that.
Yeah.
It looks so uncomfortable.
Right.
But why? I mean, it's something that we're seeing too, and probably gets missed is tooth wear, which
Hmm.
for the adult side, I have learned that the research indicates that only 8% of the population that has worn teeth actually grinds their teeth at night. Like the definition of grinding, which is side by side movement of the jaw at night when sleeping, that's caused by just activity in the brain. Like 8%. But
Hmm.
I mean, I can't tell you how many patients come in to see me and they tell me, oh, yeah, my last dentist told me I was grinding.
Hmm.
And then I start asking them airway questions and they're checking yes to all these questions. It's like, I don't think you're grinding. And then I look at their teeth and their teeth don't line up side to side. Like
Mm-mm.
they are absolutely not grinding their teeth, but it's something that's so commonly missed.
Hmm.
And with kids too, so like why grinding teeth? Like why do we see tooth wear in people that could have airway issues? Like what's happening at night? What are they doing?
That grinding symptom is showing us that the body is looking for a way of opening that airway space. And it's not that it's all night grinding. It can be a few little episodes here and there. And, other things that influence it if, your child's been sick or they have allergies or whatnot. I mean, that can definitely influence that as well. So when I ask parents about, like, I'm seeing signs of grinding on your teeth, there's some wear patterns on the tops of their teeth. Have you noticed them grinding? Oftentimes I'll hear, no, I don't. If it's just kind of an episode here or there. But if you're a parent and you've heard your child grind their teeth, you know that sound and it's horrific.
Oh,
Horrific.
it's the worst. I mean, I saw my son's teeth were getting worn and I start going down the rabbit hole. Like, what's causing this? What do I do about it? Reached
Mhm.
out to a pediatric dentist colleague, read online, and everything I read was, it's they'll grow out of it. Like, oh, if they have permanent
Often.
teeth and they're still grinding, then let's make it an appliance. But if they're doing it as a kid, they're baby teeth, they'll grow out of it. Don't give them so much sugar at night, or it just didn't fit.
No.
And I didn't realize he was grinding till we went camping, and I woke up in the middle of the night and
Mm-hmm.
heard him, and it was like, oh,
Hmm.
it's like,
Horrific.
ugh. I just laid awake for I felt like hours, like holding his jaw
Yeah.
close so he couldn't
Yes.
grind. It just,
Isn't
oh,
that
it
horrible?
totally freaks me out.
Well, yeah, you hit on something that we've been told and been telling patients for so long that they'll just grow out of it. It's normal.
Yeah.
All the kids do it, right? And that I as a hygienist was told by another employer to tell the patient that it's because they're trying to exfoliate or their baby teeth are coming out. So it's the body's way of kind of loosening those teeth up so that those adult teeth can come through. And I'm thinking, oh my gosh, how many times did I say that to a parent?
I can think of one kid in particular that is a family friend, and he is 6, and he probably has a 25% of the length of his baby teeth left. Like I have no idea, and I haven't talked at length because it's hard to say to someone, hey, look, I've seen that your kid has like 25% of their teeth left. Like, has anybody talked to you about that? It can be kind of an odd, maybe tricky conversation to bring up, especially because I'm not like close with them. But I should say more of like an acquaintance,
Yeah.
someone that we've seen in our community and we interact with. Um, but it's wild, and you wonder why these things are being missed and have been just written off as normal.
Yeah. Or how about like with our children patients that are coming in and all of their primary or baby teeth are touching. And
Yeah.
we're being told that it's normal, that their pathway is to eventually get orthodontics or braces, and that it's a normal thing. As a parent, I hear this a lot like, oh, well, I had braces and I'm fine.
Yeah.
I had an expander and all the things. I had headgear, and
Hmm.
then I have, regular braces, and it's fine. That's how my family is. That's our family. And gosh, if we can change the conversation, and there's things that, you and I may have experienced, and maybe you, the listener, experienced that, wow, it could have changed our whole development, our, adulthood, our sleeping patterns, our eating patterns, all of that. And I keep going back to it, and it sounds so simple and so silly, but it's really that airway health. And we'll get more into about tongue placement and all that, but that is what we're looking for. Bottom line.
Yeah.
Yeah.
It's really strange. It's really strange to think that breathing through the nose has such a significant impact. But
Hmm.
this isn't something that's just made up. It's well established. I mean, culturally, this is something that's been taught in cultures across the world, and we know that from anthropological studies
Hmm.
that people have been teaching that nose breathing, nasal breathing is incredibly important. And in some cases, that people, historically have been shamed for breathing through their mouth
Hmm.
because they appear less intelligent or uh, it's yeah, it's really wild. It's really wild. I want to circle back to some signs and symptoms of airway issues and mouth breathing, especially why it affects quality of sleep and why someone may not know that they're mouth breathing, especially if it's been a chronic issue. What are some just the simple reasons why someone is not getting enough rest if they're mouth breathing, and especially how this affects kids and adults?
When we are doing mouth breathing, or we have a combination of nasal breathing and mouth breathing, our body's response to that is we're no longer in that parasympathetic pathway.
And what is parasympathetic?
Parasympathetic is that rest and digestive pathway. And it's really important that we're in that pathway of our nervous system, because that's when we're sleeping, that's when we get, you know, regeneration of cells, and we are repairing our body, and we're having that reparative sleep that's so necessary. When we're in a stressful environment brought on from our sympathetic pathway, things like cortisol levels get heightened. We don't get as much oxygen into certain organs like our brain and our lungs and our heart, because we're trying to, in a way, fight off whatever is causing our body to respond in that stressful situation. Sympathetic pathway is also known as fight or flight response. So we spend so much energy and so much of our resources on fleeing from whatever stressor that our body is under, and not in that reparative state. So things like our REM cycle are being altered. We're not getting into that restful and rejuvenation type of sleep. We're kind of in this heightened alert state of a light sleep. And everybody's sleep patterns may look differently.
Hmm.
I think a sleep study is always warranted if we're having breathing concerns, to see what our sleep patterns are like. But if we think about it, if we're in this stressful state of sleep, how well can our child develop throughout that? How well can a parent or an individual feel the next day? And so that's really the big, kicker here. We don't have to be in this dysfunctional sleep. We really can be having restful sleep and intentional sleep.
Interesting. So you're saying that it sounds like we have like hard science, hard evidence that mouth breathing just in itself and the what causes it, of course, is keeping us in a heightened state so much that we're not getting the proper hormones released at night to repair our bodies.
That's right.
And that's just yikes. That's concerning. That is
Hmm.
concerning. And I know that cortisol is a stress hormone, and if that is going through our body all night, that inhibits growth hormone, right?
Hmm.
you may understand growth hormone to be something maybe that is just necessary for kids to grow,
Mm-hmm.
right? Kids have a lot of growth hormone because they're growing fast, and then maybe when we're adults we don't have it. But it is really important for adults too because it helps to repair our body and
Mm-hmm.
stimulate that growth. And I believe it's released during REM sleep, right? Like
Mm-hmm.
deepest stages of sleep.
Mm-hmm.
And so if you're not getting there, then your body's just in a constant state of breaking down.
Right. It's in this
Yikes.
inflammatory response, and it has so much to do with our endocrine system. I just, it, again, it sounds so simple, but it is so influential.
Yeah. And I feel like it's really important for listeners to understand why, like what's this relationship between non-restorative sleep and mouth breathing? Like it seems like what is actually going on that causes the loss of restorative sleep, the cortisol, the heightened state all night, that then increases our risk of having other diseases and increases the risk of children not developing correctly and developing things like ADHD.
There's a whole realm of science called sleep disordered breathing. And really, that's what's boiling down into it, that we have this disturbances and this resistance within our airway system, whether the tongue is falling back and causing us to basically not breathe through sleep apnea, or we have snoring episodes, which is blocking a lot of that oxygen coming into our bodies, and it's known as like upper airway resistance syndrome. And it's really that influential portion that is just constantly keeping us awake. Your body is kind of fighting off these disturbances. So no wonder why we're not having that restful sleep.
Because it's just preventing that that disturbance is just preventing that body from getting into that state where it heals
Mm-hmm.
physically. So it's
Mm-hmm.
it's just playing catch up, breaking
Mm-hmm.
down day after day, week after
Mm-hmm.
week, year after year.
Mm-hmm.
Yikes, which just adds up. And goodness, it's scary to think about that because if the fact that 9 out of 10 kids have some sort of airway resistance, underdeveloped jaws problems, then how's that going to contribute to their life long term?
Right. What more could they be or do or excel at had they been breathing well in the first place, then sleeping well, and then ultimately developing well? It's so influential, and so it's such a cascade effect. I think that we're really in this pivotal moment of having it be a part of our normal conversation with so many different providers, but especially in the dental space where we see the signs and symptoms of really even just, I mean, the start of airway concerns.
So what is airway medicine? Like we've talked, I feel like we've really made it clear what the airway issues are, some signs and symptoms, why it's important, why it's a risk factor. I mean, basically, why every person should care. So, what is airway medicine? Like, what are we doing? And why do you think oral care specialists like hygienists and dentists seem to be spearheading this effort to raise awareness rather than maybe more traditional providers like ENTs or pediatricians?
Hmm. I feel like airway medicine is so encompassing about, of course, breathing, but then we're also looking at sleep, we're looking at nutrition, we're looking at development, and it has so many multifactorial components to it, um, that when we're discussing airway, that there's so many providers that could have an influence and have a guidance and have a pathway for people to heal and to overcome airway concerns. But specifically for dentists and dental hygienists, we are looking at signs and symptoms all the time. When we're in doing an oral exam, there are so many factors that are showing up, they're manifesting in the mouth first, that we really have this unique and special space. And we're seeing them on you know, every 6 months or every 3 months, depending on the patient,
Mm.
we see them more often. And if we can capture that, I think we really do have a responsibility to at least start that conversation, to plant the seeds about just addressing certain symptoms and signs, and maybe have that conversation of airway.
Awesome. Yeah, and it makes sense, right? Because as a dentist, I will, and I know as a dental hygienist, we both will point out issues and receive the response of no one's ever talked to me about this.
Mm-hmm.
Like no one's ever talked to me about the issue that my snoring is a problem, or that my tooth wear is not traditional grinding. Maybe not so much the snoring, because most people it's a pretty obvious concern and it's pretty disturbing.
Mm-hmm.
But also, just because you're not snoring doesn't mean you don't have an issue.
Mm-hmm.
I had a patient the other day, and I asked if they were snoring. No. Do you have good quality sleep? Not really. And then the wife spoke up and said, "Yeah, he sometimes makes these like weird noises in the middle of the night."
Mm-hmm.
And she described them, and I said, "Do you hear him stop breathing?" She said, "Yeah, I think so."
Mm-hmm.
So he wasn't snoring, and occasionally he did, but he was very clearly not breathing throughout the night. Like
Mm-hmm.
he'd stop breathing, then
Mm-hmm.
his body would awaken him back out of that REM sleep, and then he'd start breathing again.
Mm-hmm.
It's wild, and then you bring it up, and it just blows their mind.
Yeah.
Like they
Mm-mm.
they don't realize it.
Well, I think it's become such a normal thing in life that we have either sleep apnea, or we're snoring, or we're not getting restful sleep, or your partner's tossing and turning. And it it doesn't have to be like that. That's the thing.
Yeah, yeah. Like something we preach, right? That you've all heard me say is cavities are not normal. You should not be getting cavities. It's not as a disease you're just supposed to live with the rest of your life.
Mm-hmm.
I know, Sam, want to tell us your pet peeve about the portrayal of sleep in children's play, in movies, in comics, and books, like
Yeah.
everywhere.
I feel like my kids
What
do
is
this
it?
to me because they think it's funny, but the snoring or the mouth open, or the loud, noisy breath, for sleep, and that's how it's dictated in cartoons and on TV and in shows, and I mean, it's just what is commonly known as what we're sleeping, we're snoring, and that's just not the case, and I have to look away.
Yeah,
I mean,
and like in fact, Sammy's told me that if her kids start doing that, her husband will be like, don't do
no,
that.
I
You're
know.
gonna really tick off your
I
mom.
have to walk out of the room. I'm like, I'm not doing this today.
Oh gosh, it's just crazy. It's crazy how our society accepts these very real problems and threats to our health
Yeah,
as just that's just normal.
normal,
Just normal.
normal. Or doing like band-aid fixes with
Yeah.
things, and like, or we could look at root cause, and we could address dysfunction, and we could address the root cause and go from there.
Yeah.
Mm-hmm.
And diving into diving into the provider side of this, like the so what do we do about it? So, what is airway medicine? It's really intercollaborative, right?
Mm-hmm.
It takes a whole team. And I feel like in some ways why it gets a bad rap is there's been maybe this pervasive culture of like, oh, just snip the tongue tie and then
Yep.
everything,
Yep.
like everything goes back to normal.
Mm-hmm.
But then you and I have both had patients where that has been the case,
Mm-hmm.
and the tongue tie gets released and things don't change.
Right. It's not addressing the root cause.
And then they reattach.
Reattach.
And then we have the same issue all over again. So, and I feel like my perspective, which is still newer in this game, much newer compared to, Sammie or other professionals. But what I've learned so far is I feel like myofunctional therapists really are the quarterback of this process.
Mm-hmm.
Like you are the one in the trenches doing the evaluations, working on tongue posture, which is, I mean, one of the just the basis
Mm-hmm.
of is one of the root causes of the of mouth breathing at large,
Mm-hmm.
because the tongue's not where it needs to be. Then we breathe through our mouth instead of our nose. It's like an
Yeah.
on off switch. So who are some this like multi-disciplinary approach, who are some other therapists that you work with
Hmm.
to accomplish, like, what does this process look like of getting someone well? Is it just, snipping a tongue tie, going to one provider? Like, what does that look like?
It's hard to say what each individual's journey will look like, but people who I often refer to are going to be individuals like a cranial sacral therapist that is working on the central nervous system to kind of calm down whether we have, bundles of nerves from a, traumatic birthing experience, or we have a tongue tie that's holding us in different body positions that our body is not used to or doesn't want to be in. Um, they're a great resource for pre tongue tie releases and also post-op care. Kind of gets us into that relaxation state. Um, Orthodontists, where we're looking at tongue posture, we need tongue space to have that tongue in the correct posture. So working with airway centric orthodontists that understand that it's not just about aesthetics, that we're really looking at full on airway health as being the main concern. Chiropractors are also a great and valuable resource. Speech language pathologists are valuable resources as well. There's so many other components, whether it be like a mental health therapist, a sleep consultant, even nutritionist might be on our list of providers. But really, your central team with your airway centric dentist is a huge player in the game, as well as like your pediatrician or a primary care provider.
Awesome. Yeah, it's Dr. Zoggy. To go back to him, we mentioned him a couple times at the beginning, but Dr. Zoggy's really become the expert. He's an ENT
Mhm.
by training and surgeon, but he has become one of the key drivers in progressing this profession,
Mhm.
airway medicine, and in doing the research, raising awareness, coming up with solutions. And he's such a good example of what that looks like, because he is not oh, I can fix everything.
Totally.
Right? He has, like, if you look at the list of the providers that he works with, it's like you on his website, you like scroll and scroll and scroll.
I know. I was just thinking like, oh, I forgot physical therapists and occupational therapists and
And speech language
all
pathologists
these
and lactation
providers.
consultants and
So
chiropractors.
many. I know.
It's sometimes it requires a big team,
It's huge. Yeah.
but he's just the amount of research he's compiling
Mhm.
is just it's overwhelming, and it's very clear.
Yes.
It's very clear.
Hmm.
And the surgery aspect, when it's needed, has become a lot less invasive,
Right.
which has been great.
Less is more.
Yeah, less
Hmm.
is more when it comes to tongue releases. It doesn't take a lot, and right, and something, patients ask frequently, like, oh, should I get his tongue tie released, or should I get her tongue tie released? And our response is,
It's if it's necessary. And if it is necessary, we're going to prepare for that. We're not just going to go and snip a tongue tie and send them on their way. It is being prepared with looking at what providers do we need to get in order, what therapies do we need to be doing before that surgery, do we need to do that surgery when we do that surgery, and then have a game plan for after that surgery. We want that patient to have the optimal amount of success for that release. Yeah, but it's not just snipping anymore at all.
how does the preparatory work leading up to this little surgery, how does that make a difference for the success of the surgery?
It is night and day for that success. You want your provider who's performing that surgery to have the most optimal anatomy given to them. That looks like, with me as a myofunctional therapist, I'm getting my patient prepped and ready for tongue posture. We're looking at tip to spot, meaning that that tip of the tongue is at that correct spot in the mouth. And then also if they can do what's called a lingual palatal suction, meaning that if you were to make like a click sound, that click, yep,
There's an
perfect.
example.
Such a strong sound, I love it. That click sound, and hold that almost the full amount of your tongue, so your tip, the anterior and middle part of your tongue, all the way to the top of the roof of your mouth. We need that positioning so when your surgeon is in there, they have access to the fascia material that they need to release, and that things like your nerves and your
Blood vessels.
vessels are out of the way. It's really important, and plus it's strengthening that tongue up, and then also other facial muscles. So then after surgery is done, we give you a couple of days of rest, and then we're right back into to exercises and stretches again.
I can't believe we haven't talked about this yet. You're gonna die.
Oh no.
We haven't talked about tongue posture.
Oh, we have to talk about tongue posture.
We haven't even asked the listener
Yeah. Where's your
where's
tongue
your
at?
where's your tongue right now?
Yeah, where is it at? Is it at the bottom of your mouth? Like, let's talk about the full tongue. Is your full tongue resting at the bottom of your mouth? Is it resting in the middle of your mouth? Is the tip of your tongue up? Or is the whole like tip to the middle of your tongue totally at the top of your mouth? Pop quiz. Like, what's the right answer here? And the correct answer, and what we're trying to achieve with myofunctional therapy, we want that tip of your tongue up, and it's not touching your front teeth. It is just behind. There's a little pad of tissue called your incisal papilla. So if you were to make the N sound, that would put your tongue in that correct position. The N would place it in that spot, and then also pulling that middle of your tongue up. And it sounds really easy for people. Like when I'm initially talking about myofunctional therapy and what we do, they're like, oh, I can do that. Hold it there. When you're not talking, eating, or drinking, your tongue should be resting in that position day and night. That's tongue position. If it's not there, that's when you seek out a myofunctional therapist. And what a myofunctional therapist is, it's like essentially like a physical therapist, right? We give exercises and stretches, and I also do breathing exercises as well with my patients, but we give exercises and stretches that are trying to restore form and function of the tongue muscles, of the facial muscles, and the neck muscles. And we're trying to get them to be independent with each other, or from each other, I guess, because we really want that tongue to be solely the on and off switch for that mouth breathing. Um, but really, it's like through play therapy, if you will. I give out toolkits, and we have sessions weekly. Typically, I'll see patients 12 sessions. Depending on the patient, might see them more. Have one right now who's on 25 because she likes having that accountability type of coach with her. And also she's kind of waiting for, a tongue tie release maybe in the future. So she just wants to keep on it. But typically it's 12 sessions, about 30 minutes or less. And it's just being aware. It's doing the exercises throughout the week, and then continuing those exercises after we're done together as a myofunctional therapist patient. And it's really addressing basically like compensatory body motions that we do, or habits that we do when we are forced to breathe through our mouth, or we're forced to do a combination breathing. So yeah, we look at tongue posture, and we look at tongue space, and we look at all those things. So it's all part of the gig.
One of the mantras that Dr. Zagi says is tongues up,
Uh-huh.
lips closed, healthy breathing through the nose.
Yes.
And as you talk about tongue posture, I took note of it too. Like my tongue likes to rest up and be like touching the
Yes.
back of my front teeth.
So many people
And if
do
I
that.
move it back, I don't have enough space.
Yeah.
Like my palate isn't wide enough to get my tongue back there. And I have, when I went through braces and orthodontics, like I had an expander to expand my upper jaw, but I didn't get enough expansion.
Mm-hmm.
And to compensate for not having enough room, my orthodontist had to flare out my teeth in the
Yes.
front just to get everything to fit. And I feel like just my forward tongue posture has certainly contributed to that. And if I try to put that tongue up in the proper place, it's hard.
It's hard for me.
It's
Yeah.
hard.
Yeah.
And so you, as if you're a parent that's listening, this is something that really, if you, especially if you have a child that's prepubescent, hasn't hit puberty yet, this is the ideal time to get help. And if you have a 10, 11, 12-year old, but they haven't quite hit that growth spurt yet, like, you need to get them to an orthodontist ASAP, because
Mm-hmm.
you want as much expansion, as much jaw, width as possible, because that widens the base of the nose.
Yeah.
And if you have a wider nose, it's going to be easier to breathe through
Hmm.
it. And you're going to have more space for your tongue. So, Sammie, let's share some success stories
Okay.
that you've seen of patients that you've had where their life has changed from going through myofunctional therapy and other therapies. And then, if you will give the listener some resources, which we will have in the show notes, that they can refer to find a myofunctional therapist
Hmm.
or a provider that can help them get started on this journey.
Yeah. I am I'm always so excited to talk about success stories because if the patient is being compliant with myofunctional therapy exercises, most people are going to see some benefit. The one I want to talk about today, she was 12 when we originally started to see each other for therapy. She's now 13. It's been over a year-long process for us being together. And really, it was, I noticed her as a hygiene patient. We had some major crowding, and at 12 years old, we should have most of those primary or baby teeth out of the mouth, and she had probably half left in her mouth retained
Yikes.
because it was so crowded in there. Anytime she had,
That's 50% of the baby teeth.
yeah, and so you can
Like,
imagine how small her jaws were and bone structure was. She's an athlete. She loved to play volleyball. She loved to run, and was really trying to get that growth spur and, accelerate her skills. And so that was her motivational factor. She wanted to be better at volleyball, really, and breathe better and all the things, especially when she's doing conditioning. She wasn't sleeping well, toss and turn a lot at night. Her dad was really concerned because there had been history of sleep apnea in the family, and he just wanted to avoid that at all cost. And so, little signs and symptoms we're talking about, like, have you seen an orthodontist? And she's being told to wait, that she'll grow. And at 12 years old, honestly, like, that's that growth pattern. We should already be grown. So I really encouraged mom. I'm like, listen, let's at least explore this option about airway health. Maybe you should go see an orthodontist. Um, she was, I was grateful that she took my advice, especially for myofunctional therapy. We started seeing each other, doing exercises and stretches, and her posture changed dramatically so much. In her initial photos, her head is like coming off of her shoulders, that she is forced to kind of head that head tilt to be able to breathe. Um, and she started sleeping really well. And mom and dad started noticing that she was waking up feeling really good and that she was really aware about her posture of her tongue and all the things. She got into expanders. Oh, wait, back. We did a tongue tie release this summer with her, and she did phenomenal with that tongue tie release. We worked really hard for about 7 sessions before she went and had a tongue tie release. Afterwards, we worked really hard, and she recovered really well from that tongue tie release. And then she got into expansion. So now she has this like huge growth spurt as far as her jaws are concerned. That expander's coming off next month, and then she'll have traditional braces put back on. But I love talking with her because she looks totally different. Everything's really nice and wide and broadened. All her primary teeth are now out. She only has adult teeth in there, which is exciting. She is killing it as a volleyball player. She made the top squad she's in middle school. She made the top squad for that, and super excited about that. She's sleeping really well. She's telling me that she's breathing really well when she's sleeping. She feels really good when she wakes up. So it's been such a great and rewarding journey to see her, where she initially started out and then where she is now. She wants to continue myofunctional therapy. I'll take it. She's like a lifelong friend now. It's so cute. She's adorable.
that's so great.
Yeah, it's really fun to see that. I've had other patients who I'm really excited to talk about too. One, her major concern was that she's always having pain in her jaw joints, so her TMJ on both sides, to the point where like she can't eat. That's all she thinks about. And We do have some pretty narrow jaws, and for her future with that to widen would have required surgery. So she just wanted to try myofunctional therapy, less invasive things first. Always had to have night guard because she felt like she was clenching or grinding her teeth at night. So we saw each other for 12 sessions. I just had a follow up with her 3 months after her last session. And she said, I haven't even noticed my joints. I haven't even noticed my jaw hurting. So she's like, she's a runner. She wants to breathe really well when she's running. And some to me, that's a huge success win. And I mean, for her to be out of pain like that on a daily basis, she's young. She's 23 years old. Like she needs to be living her life. Like go do your thing, girl. So that's really exciting. Things like that, that not everyone's goals and motivation are the same. But yeah, it's exciting to see that. It's
That's
super rewarding.
that's what I love about this. It's who would have thought such significant changes would result, even in a fully, matured adult, in strengthening facial muscles and the tongue
Right.
and tongue placement. It's just it really is mind blowing, and I
Mm-hmm.
can't. It's especially the 12-year-old, now 13, that you worked with.
Mm-hmm.
It's sad to think where she would be at if you hadn't said anything,
Right.
if you didn't have the training, and if parents would not have said yes
Right.
to, especially in some critical years of growth and development.
Totally.
It's really wild. So tell us where our listener can find more information on how to find a provider they can work with
Mm-hmm.
to get this journey rolling.
I think one of the best resources we have out there is airwaycircle.com. It is founded and formed by myofunctional therapists who, at heart, really do care about encouraging the growth and development and airway health of all of the patients that they see. And they're huge on collaborative care. So you'll find myofunctional therapists there. You'll also find other providers, but um, like Dr. Clayton was saying, like a myofunctional therapist is essentially like a quarterback. Find a good one. Um, and really that's that start of that process for you. Airwaycircle.com is great.
Yay!
Yay.
I hope you've enjoyed all the information we've shared with you today. We are very passionate about this, and if you recognize any of these risk factors in yourself, please, please, please go to airwaycircle.com, find a provider. And Sammie, where can they find you if they'd like to work with you personally?
I think the best resource to find me is on Instagram, and that is at breathe.well.myo.therapy. That would be the easiest.
Well, thank you again for being here today with us. Sammie and I love talking like all the time. Our office manager gets mad at us saying, "Stop talking to each
We
other."
get in trouble a lot.
Like,
It's all right.
yeah, so it's great.
It's fashion.
All right, Sammie, we'll nerd out again real soon.
Okay, toodaloo.